tell you what is prostate cancer and how do you screen for it, or how do you pick it up. And that's a combination of a finger up the bum.
Oh no!
And a blood test.
Ouch!
So again, we're going to use the award-winning movie, Healthy Bastards, which includes myself, Clark Gable, and that James Bond fella. And we're going to tell you what is prostate cancer and how do you screen for it. So look, phase on in fellas and have a look. What is prostate cancer? Now this is what all of us doctors really want to pick up because it's increasingly common. And the thing that bugs us is that a lot of it could be treated. It's presenting too far advanced, and so there's not much you can do. So the thing to understand about prostate cancer is that, say if this is a prostate, the cancer starts in the capsule and grows inwards. So what that means is that by the time you get constriction of the P-tube or urethra, it's very advanced. So that's what I mean, is that you have to pick it up early before you start getting the symptoms, and you do that with screening checks. Okay blokes, let's do a prostate examination. Now so many guys are howly bag about this. Woman beaters, hands down. You gotta have it checked, alright? So come with me and we'll do one. But before you get a prostate examination done, just make sure the doctor has got a fine set of gloves. So, let's do it. No whinging, come with me. Come on. Can't get away now. Come on, through you come. Here we go, folks. This is the perfectly positioned male for a prostate check. And here, voila, we have the anal cavity. So, to examine a prostate, what a doctor does is, with the gloves on, gets a little bit of lubricant for the supreme version. Now, what is the doctor feeling? The prostate is buried deep within the pelvis. The only way to feel it is through the anal canal, and that's why guys get all twitchy. But there's nothing to it, real quick. So I'm trying to demystify the whole experience. So, a normal prostate is, when I poke my finger in the anal canal, is a small lemon-sized organ which is smooth with a little dip in it, and it's non-tender. So let's check it out. So we slightly part the buttocks, put the finger in the anal canal. The anal canal is about that long, and then I can feel the prostate. It's the size of a small lemon here, smooth. There's a dip in it. Yep. Is that tender, sir? It's non-tender. We have here the perfect prostate gland. An abnormal prostate will be tender, and so the male will jump off the bed. It could be an infection. A cancerous prostate, it's hard and it's lumpy, and that's why you're doing this. There's nothing to it. So come on blokes, get your prostate checked. So I can reassure this man that he has a normal feeling prostate, but it doesn't quite end there. There is a blood test which complements the examination. It's called the PSA. So I'm going to sign off a blood test form to this man, and over the next couple of weeks you'll get this blood test, and that finishes this screen for the prostate examination. The question is when should he come back? Well, if you've got a family history of prostate cancer, the general consensus is to get checked every year after the age of 40 with an examination like I've done and blood test. If you have no family history, the consensus among specialists is to get checked every 2 years after 50. So after doing this, what I can do is I can reassure this man he has a normal feeling prostate, and hopefully the blood test will be fine. So on behalf of the Bulls Medical Centre, I can certify this man fit to travel. Thanks. And there's nothing to it, is there, blokes?